Health Literacy in Postnatal Depression, written by Talia Santa-Catarina, Daniela Fox, and Michaela Henderson. What is health literacy and how was it developed? Voiceovered by Talia Santa-Catarina. What is health literacy? Health literacy plays a major factor in the overall health of a patient. Studies have shown that poor health literacy is associated with poor health outcomes for patients. Health literacy can be defined by the way individuals understand the information by a health professional and how they apply this knowledge to their healthcare by making informed decisions. It is estimated that 60% of Australians don't have the standard of literacy levels that are considered satisfactory. This poses an issue within the Australian healthcare system as individuals don't have the knowledge required to navigate the healthcare system, seek and support from their health professionals, as well as understand the medical instructions provided. Health literacy gives people the knowledge to maintain their health, manage minor illnesses, navigate healthcare services and systems, as well as improve their overall environment and conditions. As a result of limited health literacy levels, individuals have an increased risk of emergency care, hospitalization, and as well as mismanagement of medication and their disease or condition. Low literacy levels have been linked to high healthcare costs as well as impacting the safety and quality of healthcare. The development of health literacy. The Australian Commission on Safety and Equality separates health literacy into two main components, being individual health literacy and health literacy environment. Individual health literacy is the knowledge and capacity of a person to understand and access information to make appropriate decisions, whereas health literacy environment is the infrastructure, policies, and processes that make up the healthcare system. Strategies have been developed to measure an individual's health literacy levels through basic scanner tools. This involves questionnaires, conversation tools, and that discuss specific topics. Health literacy questionnaires are often used by the Australian Bureau of Statistics to collect data from the population. There are a number of underlying factors that can affect the health literacy, which include cognitive and intellectual disabilities, generally low literacy levels, English not being their first language, and cultural differences. To overcome these factors, health literacy programs have been developed to focus on improving the way health literacy is communicated between both health professionals and the patients. Health literacy strategies include improving the design and understandability of written materials, providing extra information to help people understand their health conditions, and using communication techniques such as teach back, where the professional asks if the patient has understood the information provided. Disadvantaged groups also reportedly sought out healthcare as a result of their poorer health outcomes. Women have reportedly sought out healthcare more than men have, and with issues arising such as postnatal depression, women need that extra care.
Postnatal depression has received limited attention in mental health literacy research. Postnatal or postpartum depression is a non-psychotic depressive disorder that occurs after the birth of a child, usually up to a year after delivery. Postnatal depression affects between 6 and 13% of new parents, but only a small proportion of individuals who meet diagnostic criteria received optimal care. The reason for this is poor mental health literacy. Stress, depression, and anxiety are the most common complications experienced by women during their prenatal and postnatal periods. Poor mental health during the prenatal period is identified as a major public health concern and is the biggest unaddressed health issue of our age. Without treatment, over one-third of women with prenatal mental health problems will experience unremitting symptoms that persist into their child's preschool years. However, despite frequent contact with healthcare professionals during pregnancy and post-delivery, the vast majority of women do not seek help for symptoms of stress, depression, or anxiety, or voluntarily disclose their symptoms to their GP. While system-related barriers limit the accessibility and availability of mental health services, personal barriers such as views of mental health and its treatment are also cited as significant deterrents of obtaining mental health care. Very few pregnant women and postpartum women productively seek help or engage in treatment, and less than 15% of pregnant and postpartum women receive the needed mental care. An individual with good mental health literacy would be able to identify the mental illness in themselves or others and then seek or recommend appropriate resources of help. However, research into mental health literacy in Australia has shown to be generally poor. High levels of mental health literacy will increase the likelihood that mental illness will be recognised. This will increase the possibility of appropriate intervention and social support. In 2000, the Australian government sought to redress the knowledge defect with respect to depression by investing in primary health care and increasing the availability of services. To give voice to the strategy of education and communication about depression, a health promotion agency, Beyond Blue, was developed to raise community awareness and reduce stigma. Although mental health literacy for depression may have improved following Beyond Blue's inception, similar improvements cannot be expected for other mood disorders such as postnatal depression. Mental health literacy for postnatal depression or non-psychotic depression diagnosed either during pregnancy or in the first 4 weeks of postpartum has not been systematically assessed in the Australian public. Recognition of postnatal depression presents some unique difficulties, with many women assuming that the symptoms are a normal part of parenthood and the result of fatigue, relationship strain, and personal weakness rather than depression. And these perceptions are often supported by family members. These emphasise the vital nature of increasing community mental health literacy for postnatal depression. The Australian government has already introduced some initiatives to improve screening and treatment for postnatal depression. In 2009, the National Prenatal Depression Initiative was introduced. All pregnant women and new mothers are routinely screened for depression. This will increase the numbers of cases identified. It may depend on the individual's mental health literacy as to whether they will engage with treatment. And it is important for the cause of postnatal depression to be recognised as a misattribution of cause and hinder on appropriate help seeking for those affected. Research shows that instead of a defined cause of postnatal depression, they are recognised as risk factors. The combination of risk factors is unique to each woman. These include a history of depression or anxiety, stress of life events, lack of social support, poor relationships within the marriage, or low self-esteem, and difficulties with childcare, or a difficult infant. Sometimes it is looked at as for baby blues.
The role of the registered nurse in the development of postnatal depression health literacy by Danielle Fox. Postnatal depression is a common health issue. According to Women's Health Statistics, 1 in 9 mothers are affected from postnatal depression. As this statistic is so significant, it is essential that healthcare professionals like registered nurses can use their skills to ensure these statistics can be reduced and one day be fully preventable. As a healthcare professional, it is vital that optimal care is provided to ensure positive health outcomes. To be able to achieve these outcomes is important. The promotion of health literacy is implemented early into care for people who are at risk of developing postnatal depression. Proficient health literacy is important because, as outlined by Cho, Han, and Park, poor health literacy skills increase an individual's risk of not receiving treatment or receiving treatment too late. People are also experiencing poorer treatment outcomes compared to those with more advanced health literacy, and people are needing more treatment and needing to use other services due to lack of health literacy. Initially, before promoting health literacy, registered nurses must be educated on the discussion topic. As stated by Field, Abrahams, Woods, Turner, Onar, Kura, and Hockerman, by participating in courses and reading evidence-based literature, this will ensure of the upkeep of education for continued professional development. When registered nurses are appropriately educated, this will assist with the improvement of health literature that is provided to others. Providing appropriate health literacy to consumers with postnatal depression can assist with early identification of signs and symptoms of the disease, so those who are affected can receive help with how to cope. Strategies to help with the early identification of postnatal depression are tools like the Edinburgh Postnatal Depression Scale. This is a screening tool that aims to identify possible symptoms of depression in the postnatal period. This tool aims to identify women who may benefit from follow-up care such as mental health assessments, which may lead to diagnosis based on accepted diagnostic criteria. Effective communication is an important element of promoting health literacy, as consumers need to have an understanding of their own health. Using simple language and avoiding the use of medical terminology and jargon can be beneficial for minimizing the risk of misunderstanding. Methods to show that communication was effective is the teach back method. This is to determine if a patient has understood your instructions and can repeat the information in their own words back to you.